As a paramedic in Australia, mental illness is a frequently encountered health issue that spans across a vast variety of patients. Because of this, it is imperative that Queensland paramedics are aware of their patients' healthcare rights and when these rights can be deprived. In Queensland, mental illness is defined as a clinically significant disturbance of perception, mood, thought or memory. However, mental illness does not encompass an individual's personal preference regarding religion, politics, philosophy, sexual orientation, preference or promiscuity, the use of drugs or alcohol or the choice to engage in illegal, indecent or antisocial behavior, or their race, social or economic status or a history of mental illness. To determine if Odessa classifies as a mentally ill patient according to Queensland legislation, we must first identify if she fits the description of a mental illness. Thought disturbance is a broad term, encompassing many different disorders. However, generally speaking, thought disorder is a disruption of the expression, flow and form of thought. This is usually inferred from one's speech. Some examples include problems with stream of thought, causing a person to have difficulty sticking to a particular point or topic. Other thought disturbances arise from problems relating to comprehension and formulation of thought, difficulties with attention and concentration, the inability to plan, organize or conceptualize thoughts, or delusions, obsessions, phobias, and thoughts of suicide or homicide. Mood is defined as a subjective and internal state of feeling or emotion. Significant mood disorders can range in severity, from extreme depression, which displays feelings of melancholy, guilt, worthlessness, and suicidal thoughts and ideations, to extreme elevation which is characterized by inflated self-esteem, grandiosity, euphoria and disinhibition. Perception is the ability to perceive stimuli according to one's senses. Disturbances of perception can include hallucinations. These may be in the form of auditory, visual, olfactory, gustatory, tactile or kinesthetic hallucinations. Other forms of perception disorders can include misinterpretations and illusions or feelings of separation or detachment from the external environment or physical body. Lastly, disturbances of memory include alterations in level of consciousness, awareness and orientation, such as the inability to determine time, place and person. Memory disorders can also affect a person's immediate retention and recall, and their recent and remote memory. From evaluating the clinical presentation of these disorders, and combining this with the content provided in the case study, it can be determined that currently, Odessa is not experiencing any clinically significant disturbances of thought, mood, perception or memory. Odessa's abnormal neurological symptoms seem to be transient, caused by her temporary hypoglycemic state, and therefore should not be considered a mental illness. In the legal context, capacity is defined as the ability to make decisions, and is determined by a health professional's thorough clinical assessment. Individuals with a diagnosed mental disorder may still have capacity, and therefore can make decisions. Capacity is reassessed as necessary, dependent upon the individual's ability to make an informed decision when presented with options. Capacity is a state that varies circumstantially. Furthermore, it can vary within domains, when different decisions are required and based on the type of information presented. As Odessa has refused transportation to hospital for further treatment, the attending paramedics were required to complete a work assessment for the validity of her decision. It was recognized that Odessa's decision was made voluntarily. The attending paramedics informed Odessa that her blood sugar level could deteriorate, which may have life-threatening complications. Odessa specifically refused transportation so as to complete her errand, making it clear to the paramedics that the refusal was relevant. In terms of capacity, 17-year-old Odessa is classified as a minor. Thus, within her refusal of medical treatment, paramedics need to determine if she has the capacity to refuse health care as a minor, otherwise known as Gillick competency. This is an assessment to show that the patient has sufficient understanding, intelligence and maturity to appreciate the nature, consequences and risks of the proposed health care, and the alternatives, including the consequences of not receiving the health care. From the evidence provided in the case, it can be assumed that Odessa is intelligent and has sufficient maturity to understand the nature and purpose of the treatment being recommended, but more importantly, is capable of understanding the consequences of refusing transport. Furthermore, it's important to note Odessa was not intoxicated or experiencing fluctuations in her conscious state at the time of refusal. This evidence allows us to question Odessa's treatment provided by the paramedics, in particular the implementation of the emergency examination order. According to the United Nations Universal Declaration of Human Rights, Article 3, everyone has the right to life, liberty and security of person. This is echoed in Victoria's, the Charter of Human Rights and Responsibilities. The right to liberty includes the right to not be arrested or detained except in accordance with the law. Therefore, to impinge on the nationally and internationally recognized and protected right to liberty requires extenuating circumstances. In Queensland's recently updated Mental Health Act 2016 Section 921, Subsection 157b, the justification for the deprivation of a person's liberty on medical grounds is quite clearly stated as a. A person's behavior, including, for example, the way in which the person is communicating, indicates the person is at immediate risk of serious harm, and b. The risk appears to be the result of a major disturbance in the person's mental capacity, whether caused by illness, disability, injury, intoxication or another reason, and c. The person appears to require urgent examination, or treatment and care, for the disturbance. After treatment by the ambulance crew, Odessa is not demonstrating any of these characteristics. Therefore, anyone depriving her of her liberty could face criminal or civil charges or disciplinary action. As it has been determined that Odessa's refusal is valid, the paramedics should have respected their patient's decision and provided advice to promote Odessa's comfort and safety. An alternate care pathway would have been far better served by implementing the 4 principles of biomedical ethics. Autonomy is not just an individual's right to act autonomously. It is also the responsibility of those charged with their care to support and maintain the autonomy of the individual. Impinging on Odessa's right to freedom would do the opposite. Furthermore, the paramedics should endeavor to assist Odessa through beneficence and non-maleficence by supporting and educating her about the importance of maintaining her blood sugar levels, and assisting her in consuming more complex carbohydrates to prevent another hypoglycemic episode. This could have been done whilst waiting for the tow truck, by either running her to the local shop, asking the neighbor to make her a sandwich or sending one of the paramedics to collect some food. From this evidence, it can be determined that Odessa is not currently suffering from a mental illness that would be recognized by Queensland legislation, and subsequently, the endorsement of an emergency examination order cannot be justified. Odessa's recent diagnosis of diabetes at 17 would be difficult to comprehend, and taking her to hospital under an EO would do nothing to allay her fears or frustration at her new medical situation.